Hello, my name is Andy Erzik with the Education Department of the Milwaukee County EMS system. I'd like to take the next couple minutes with you going over some of the protocols we have updated or clarified for June of 2015. Listed below are the 4 protocols that have been changed for June of 2015. First one being 12-lead acquisition regarding ROSC patients. Second, cardiac arrest and the ability to call a code in the field without online medical direction. Third, patient restraints, the medications that we will be using specifically for excited delirium patients. And finally, controlled substance documentation and inspection. For our 12-lead acquisition protocol, ROSC has been added as an indication for acquiring a 12-lead. As we all know, cardiac arrest can be due to a STEMI. After achieving ROSC, performing a 12-lead and recognizing EKG changes can allow us to activate the cath lab sooner and possibly provide a better outcome for the patient. Our asystole protocol allows a paramedic to call a P&B in the field if all the termination of resuscitation criteria are met. If this is the case, document medical control physician 0010 for meeting termination of resuscitation criteria. Listed below are the 8 criteria for termination of resuscitation, or TOR. First one, that the patient is 18 years old or older. The cardiac arrest cannot be witnessed by the EMS provider. The patient must be in asystole throughout the entire resuscitation attempt. The P&B cannot be related to an environmental hypothermia. The patient must have a patent airway. High-quality CPR must be performed throughout the resuscitation attempt. 15 minutes of resuscitation effort have been given, and that the patient has never had an end-tidal CO2 greater than 10 millimeters of mercury throughout the resuscitation attempt. We've also made some clarification to our patient restraint protocol, specifically pertaining to patients suffering from excited delirium. Our 2 medication choices we have for patients with excited delirium are ketamine and midazolam. The protocol now reflects that ketamine can be used as your first-line treatment, or it can also be given simultaneously with midazolam. The medication ketamine has recently been added to our chemical restraint protocol specifically for patients suffering from excited delirium. Ketamine is provided in a 5 ml vial containing 500 milligrams of ketamine. For an adult, the IV dose is 1 milligram per kilogram. This must be diluted equally 1-to-1 with normal saline, up to a max dose of 100 milligrams. If ketamine is to be given IM, the dose is 3 milligrams per kilogram. This is not to be diluted. Max dose 300 milligrams. The pediatric dose is the same as the adult, 1 milligram per kilogram, up to a max dose of 100 milligrams. Once again, if given IV, it must be diluted equally 1-to-1. Since ketamine is a very powerful sedative, it is very important to monitor heart rate and cardiac rhythm, the patient's blood pressure, their level of consciousness, and the possibility that the patient is having hallucinations, and if the patient has excessive salivation. The only contraindications for ketamine is hydrocephalus and allergy to ketamine. The controlled substance documentation and inspection protocol now allows paramedics to waste expired drugs and vials with broken seals in the field. Drugs are to be wasted under new guidelines instead of returning them to Milwaukee County EMS or Freighted Pharmacy like we've done in the past. Shown here is the new controlled substance documentation and inspection protocol updated June 1st of this year, 2015. Per policy, administration of controlled substances will be uniformly documented to accurately reflect usage. Controlled substances will be visually inspected for seal damage and volume discrepancies. Each day, paramedics visually inspect the controlled substance vials for seal integrity and the appropriate volume. If there is a volume discrepancy, notify the Department Administration immediately for further instruction. Department Administration will notify EMS Administration of the discrepancy. If there is no volume discrepancy, check the seal of the medication. If there is any suspicion of a diversion attempt, once again, notify Department Administration immediately for further instructions. If the vial seal is undamaged, then proceed to check the medication's expiration date. Once again, if the medication is expired, empty contents of the drug vial into sharps containers. 2 paramedics are required to complete this process. After disposing the medication, you must document controlled substance administration record. You need the vial number, date, time, why drug was wasted, whether it was expired, broken seal, not used, etc. Also the amount given and the amount wasted, plus the total dose in the vial. Again, both paramedics must sign record. After that, log number vials and reason for return waste in controlled substance monitoring system. When this is completed, return the controlled substance administration sheet to Milwaukee County EMS offices after all medication vials have been accounted for. If no discrepancies are found in the medication, log daily count in controlled substance monitoring system. Check to see if it is a study kit. After that, administer controlled substance as ordered by protocol or by medical control physician. Continue patient care and transport. Document on the controlled substance administration record the date, time of administration, patient's name, amount of medication administered, and amount of medication wasted. Once again, this requires 2 paramedic signatures. Finally, sign and have the controlled substance sheet co-signed by another paramedic. Then, return the controlled substance administration sheet to Milwaukee County EMS offices after all medication vials have been accounted for. Further note, Milwaukee County EMS will perform routine visual checks as well as auditing each med unit to assure documentation is complete and accurate. Records will also be reconciled with Freighter Pharmacy at the end of each year. This concludes the changes made for June of 2015. Thank you very much for your time.